From celebrity lawsuits to viral controversies, this is Exhibit A-List, where pop culture gets cross-examined. I'm Jasmine Wegg, and I'm your lawyer bestie breaking down the legal stories everyone's talking about. Welcome back to Exhibit A-List. We're all following the Lindsay Clancy trial, and there's a version of the Lindsay Clancy trial that's only about one night, and there's a version that talks about the 4 months before it. And today I want to talk with Dr. Leslie Dobson about those 4 months leading up to what happened. She's been following this case and posting about it all the time, deep insight from a psychological expert's background. And I think this conversation is going to shed a lot of light on what we're seeing every day as we watch the trial along with the rest of America. So thank you so much, Dr. Leslie.
Yeah, of course. I am so happy to talk about this case because the world is watching and seeing how just what a nightmare the American healthcare system is, the training, and a lot of our licensed professionals.
Been eye-opening. It really has. It's funny you say that because I was thinking for a moment, I've been talking about malpractice on my podcast a little bit, and I was thinking that, when lawyers screw up, I mean, I don't work in criminal, so when we screw up, people could lose money. But when doctors screw up, lives can be lost and horrific things can happen. And it's such a heavy, heavy burden and something you really have to do with such care. And we're seeing a lot of mess ups. Everybody's watching this trial with bated breath. I think it's disturbing and sensational for a lot of reasons, including how unfathomable it is that a mother would do this. But what we learned at this point from watching the trials is that there were signs for a long time. We heard testimony that there were roughly 30 prescriptions in the 4 months before the killings. 12 of those came from Dr. Tufts alone. She testified that Lindsay had tried at least 10 different medications. So as a psychologist, when you look at a 4 month record like that, because the prosecution says that her medical team was not to blame and that she was culpable, what do you say about bouncing between doctors and medications? Does it sound like she's just not following through with her medication, or does it sound like a huge failure?
A huge failure. I mean, there could have been a ton of different testing to look at how she was metabolizing the medication. So we have this epic failure of more invasive testing and lab work. No one did anything. We have the failure of the total lack of communication. We have prescriptions being thrown at this woman left and right, yet the prescribers are not talking to each other. Then we finally have a therapist come in, but she wants to have fresh eyes. So she doesn't look at any of what's been going on with Lindsay. But she was brought in because Lindsay was so severe and needed therapy. So the lack of like leaning on colleagues, trusting colleagues, especially in such a small little community, which I find very odd, and often sharing the same My Chart records and similar records, or even failing to go out and trying to get the records. It's so odd. So we have that failure as well. But as somebody who's worked in hospitals and in psychiatric hospitals for years, what we do is we look at the big picture, and every discipline sits down together and talks about the care of the patient. And I've never, ever seen medications so erratically prescribed like that without any kind of real true definition or honesty about why they're doing it. And I think that like a lot of the time they literally thought Lindsay was like some kind of a psychiatrist.
And it almost makes you wonder because she came in with a medical background, why they're jumping to prescriptions. Because sometimes people who are in medicine will seek out medication to treat things because they know that these things work. But if your patient is continually so depressed despite medication, why wasn't there a quicker recommendation for extensive talk therapy as part of the protocol?
Right. I mean, I would always recommend that. And I would start it while you're pregnant, right? Because it's a huge thing to have a child, to make a human being in your body, then to have it come out with all the hormones and then parts of your body come out too. Like it's one of the biggest things that will ever happen to a body ever. So the fact that they're just throwing meds at her and not immediately talking to her with in depth therapy, education, coping skills. There are so many therapies that would be so great early on in this case. And then as she completely unravels, they give her a master level therapist. We're looking at a woman with significant severity of symptoms that she's already shown. She should have had a psychologist who was trained in postpartum psychosis.
And speaking to the psychosis, I mean, not one friend of mine on a personal level that has babies didn't experience at least some sort of either depression or anxiety postpartum. We've all talked about it. I know I experienced more anxiety postpartum. I didn't really get treatment for it because I didn't even know a name for it, but there were definitely periods where I just felt so on edge and had also intrusive thoughts, not like directly that, "Oh, I'm going to hurt this baby," but I would think, "What if the baby falls down the stairs? What if I step on the baby when the baby's on the floor?" And it isn't normal to think that all the time, but it's common. It's common to have these thoughts. So it's super common to experience this postpartum. We all know that. What is the difference between that and psychosis, postpartum psychosis?
Well, I think that 4-month period for Lindsay, the trajectory and the escalation of the symptoms paired with the exacerbation of the symptoms due to the medication is key. So I don't think Lindsay was psychotic the entire time. I think she was just like you and I. Like I had really low mood after one of my kids, or I would be feeling totally fine and I would just start sobbing for no
Mm.
reason. Like hormones were coming out, right? In my first kid, I didn't have sleep. By the second one, I actually had a night nanny, which was an epic decision, I have to say. Even though it
The
was,
sleep deprivation is a
yeah,
huge part of the effects on your mental health, and people don't
yes,
talk about it enough because when you can't sleep, you could feel crazy. When it's been enough days, you lose it.
yes. So with Lindsay's case, what we have is somebody who could have been helped early on and it was missed. And the thing with postpartum psychosis is that when that snowball starts rolling down the hill, it's fast. And then if you add to it the wrong medications, and we had the program, they testified yesterday that the program wouldn't accept her inpatient or even partial inpatient because she was in a medication induced depression. She was over medicated. So they wouldn't take her. Now, it's important to note that that's a program where you bring your baby with you. So
Mm.
they didn't want what I'm assuming is they didn't want the responsibility of having Lindsay completely over medicated and her baby there with her. But so you get to this point where you have the intrusive thoughts, right? Am I going to be able to do this? Am I going to drop the baby? You have intrusive images of your baby choking. Can I do CPR? Do I remember what it is? Right? All
Mm.
this stuff. And then with Lindsay, it started moving into almost like this obsessive compulsive state. She was losing touch with reality and she was obsessed with trying to stay in reality. She was journaling. She was writing notes in her cell phone. She was reaching out on the My Chart to the providers in the middle of the night, dozens and dozens of times. It's like she knew she was leaving reality and could not find a way to stop it. And
She
then
was
what I
crying out for help in so many ways, so loudly, and she was doing it by every means that we tell people. She was contacting her doctors, the professionals over and over and over and saying, "I don't feel well. I don't feel safe." And oddly enough, the only response was more medication. Also wonder when they thought that she was in a medically induced depression, why no one sent forth like a complaint as a provider putting her in that state, or even reached out and said, "What's going on? Why does your patient look like this?"
well, I think they did reach out and the prescribing providers didn't call them back. And I think there is no evidence in place that they reached out other than their statements that they did. And that is a part of the civil lawsuit as well. So, like, I think someone's gonna have to prove, phone records. I don't think we've seen that yet, but it does sound like they reached out because they were concerned and they didn't get a call back.
Yes.
So
And I was also looking at the civil complaint just the other day, which I think lends a lot of light onto her mental state during this whole process. And some of the things she talks about is the different dosing of her medications. I have the numbers as she went from 25 milligrams of Zoloft to 50. And then she reports that she didn't sleep for 48 hours, racing thoughts, worsening anxiety. 3 weeks later, she's put on Prozac. And so the complaint says that was a red flag for bipolar disorder. In your professional capacity, is that a fair assessment to assert?
Definitely, and I think we saw mania symptoms after her second baby, and also
Was
if you
that the
look at her
marathon?
the
Like her
she
running
was
the marathon?
over-exercising very much, and if you look at the Facebook groups she was in and the posts, I mean, she was almost bragging about being able to run the morning of giving labor or
Right. So
having labor. So it
who
was
does?
just well, it's self-medication, right? Like I'm not comfortable with my body, so I'm gonna over-exercise to control it, and we had one nurse when she was almost in psychosis tell her to go for a jog. That was actually actual testimony. But the over-exercise, I think, is a definite sign of mania paired with a lack of sleep, and the key here is that when you and I have a lack of sleep, we are tired. She
Right.
wasn't. She didn't need the sleep. That tells us that's the mania in the bipolar diagnosis.
So what should have been done when these signs of mania were arising?
I think she should have been hospitalized, and the narrow criteria for how they hospitalize over there is utterly ridiculous. Like, you have to have a plan. Whoa, no. Even if we don't get to the point of hospitalization, her primary provider, Dr. Tufts, had never worked with anyone with postpartum psychosis and had only been on her own for a month or two. So,
Yeah, let's talk about that. What do you make of someone being fresh out of residency? First of all, it's rare in a lot of fields to go off completely on your own and not work under someone when you're a newbie in law, I think in medicine as well. But the fact that she held herself out as experiencing postpartum and then she basically admits that she really wasn't. What do you make of all that?
yeah, she said it was an interest of hers. Well, she's in this mental health clinic, right? But the clinic saves money by doing everything on telehealth. So oftentimes these clinics, I mean, the providers are in their homes. There isn't even a place for the patient to go to. I would have liked Reddington to kind of hone in on that. Had she come
Yes.
see you in person, where were you? What's your office look like? Were you actually available, or were you not asking her to come in because you don't actually have a physical clinic? Like, there's a lot of
Can you
lying.
even detect postpartum psychosis on a virtual visit? I mean, maybe it's possible, but is there certain things that you would only see in person with someone? And also, we know that the visits were only 17 minutes for
Right.
most of them.
They were 17 minutes. No, I think you would miss it on telehealth a lot of the time. But also, there's so much going on with Lindsay. And I think anyone could have stepped back and seen the forest for the trees and said, "Hold on, hold on. We have so much." She's reaching out. These cries for help, the overexercising, the history. Patrick's asking for help. She's saying she wants to harm herself. We're escalating. She's fearing that she's going to think about harming herself, and that's not suicidal. I'm sorry, it is. That means she's having thoughts of harming herself, and she just said it in a funny way.
And what's this big distinction between having a plan and not? Because if anyone in my life said that they were thinking about hurting themselves, I wouldn't really ask about their plan. As a regular human bystander, I would just be like, okay, we need to help you. You're thinking about that. Why is it
Right.
so important if the person established a plan, then you consider them classified as suicidal?
It's
Is
a
that
big part of the psychological understanding of suicide is that you can ideate, you can think about it, and oftentimes all of us do. Like, what if I wasn't here anymore? That'd be cool, like whatever. But you can have the ideation, and then we move into the intention. Do you actually intend to end your life? That's the next question. Okay. And then we move into the plan. And then it's not just the plan. Are you going to follow through on that plan? How good of a plan is it? Right? So there's hours of interviewing just around suicidal thoughts that need to happen when you have somebody who has this huge picture and so many symptoms and they didn't do it. But for me, I have hospitalized patients who didn't have a plan, but me, as an authoritative figure, as a licensed psychologist, I told the hospital, I don't trust this patient. I think with the big picture of symptoms, they are dangerous. And if they don't have a plan right now, they will. And this insurance only rule of you needing a plan to actually get a bed is bullshit. And then you get your patient a bed on an
Yeah,
inpatient unit.
and it also, I mean, if you're having the urges, that's the prerequisite to the plan, and maybe the plan comes about all at once when the person goes and does it. It can't be a streamlined rule that everyone plans it out in advance. There's got to be suicide attempts and actual suicides where the plan basically runs into the actual commission of suicide. So it seems negligent for someone to tell you that they're thinking about harming themselves. To me, that's negligence because you have the actual notice that this is something that is on the table and they're thinking about it not once, but is something she reports over and over. To
Yes.
me, I see this as negligent to not do anything other
I
than
think
more medication.
there's so many layers of negligence. And like you said, medication is not the only thing that we have to help people, but it's the only thing that they knew. And none of them talked to anybody else. They didn't get guidance. They didn't get consultation. I mean, we're licensed. We have boards above us. We can reach out to people at the American Psychological Association, lawyers on staff to help guide us with our ethics. There's always someone when you're licensed in America that you can lean on and ask questions to. But there was this level of narcissism in all of those providers that just drove me crazy. Like, you're willing to see someone hurt because you don't want to ask for help?
100%. There is no world in which when you're confronted with a situation where you don't know what to do as a professional, where you don't seek out someone who has more experience than you. At every stage, there's always someone who has more experience that you can just ask, hey, here's the scenario. And I think psychiatric professionals are supposed to have mentors where they discuss this, but I don't know if a psychiatrist is similar to a psychologist in that respect, where you go and speak with your mentor on a regular basis.
I don't know. I mean, I feel like I'm just kind of left out there on my own unless I seek out individuals. And so I have like a lot of psychologists that are friends and older friends. And I ask them all the time. I have ethical questions all the time, forensic ones and clinical ones. But
Yeah, I see.
I mean, that would just be doing such an injustice to a patient to think that I'm the greatest sparkly thing that's going to fix everything. I mean, even when Lindsay said that she was worried about being addicted to the benzodiazepines, the nurse said, well, that's also a specialty of mine, so I'll work with her on that. I mean, she still didn't reach out to somebody else to put eyes on this woman who was flailing around.
Truly flailing. One thing I found interesting during the trial is this kind of intersection of law and medicine when it comes to documentation. This kind of like sparked something for me when I was hearing Dr. Tufts be asked about one of her notes. I'm going to read it so I get it right. It said, no sleep, no sleep last night, comma, falls asleep after 40 minutes, comma, heart racing, comma, severe anxiety, comma, worrying about kids, comma, baby, comma, sleep, yawns but not drowsy. And then it goes, comma, not hyper, comma, pressured speech. So the whole argument was the comma after not hyper and then pressured speech together meant that the not was not a modifying pressured speech. Reddington said the record says what it says. It seems like her notes were well written. We see lots of careful usage of the commas, which would lead one to believe that her note was reporting pressured speech. So, forgetting the grammar fight, clinically, what does pressured speech tell us and what should have been done if that was what presented?
It's a sign of mania. So it's somebody who's like pushing their words out. So they're constrained, but they're still trying to talk very, very quickly and pressured. Like, if you really want to tell someone something and they're walking out the door and the door's about to close and you just have to blurt it out. But that's how you entirely communicate throughout your appointment. That's pressured speech. And
And it's a huge indicator of bipolar.
yes, like, bipolar is, mania and depression, and they take turns, right? But the problem with Lindsay was that the mania was there, but then the medication was making it worse and really muddying the waters. But either way, there was a lot there to work with. This was not a normal case presentation, even though they want to say that. And we have to be so, you have to use so much discernment when it comes to that note and that word because she's being civilly sued by Lindsay. So
Exactly. So
if she wrote
she
pressured
has to keep
speech,
everything consistent.
yeah,
And that note was in October. So that means if she wrote pressured speech, she had an indication much before the events of the night and didn't do anything or didn't act on a bipolar diagnosis. So that is huge, like you're saying, for the civil case, because that means she knew well before it happened.
and maybe she didn't have pressured speech. Maybe it really was a typo. For her to say, I don't care what it says, I know what it means, is like, I mean, med school 101, psychology 101. Your notes are written for legal purposes. That's why we write them down. It's not for our memory. So for her to become that cagey and difficult, I mean, you would know, but to me, I feel like the jury would be like, okay, like we've had 2 psychiatrists up here now that you can't communicate with. You can't tell them if they're wrong. They don't want to hear it.
Mm. And she does come across as very cold affect. And I also wonder if that's because she is coached to not show any emotion because that might concede something went wrong because of the civil side action. I don't know, even if that's the case, if that's helping her because she's still on stand to determine whether this woman was being mistreated. And she's coming across as very callous of someone who treated someone experiencing such a difficult time.
And I mean, I'm curious what your thoughts are on this, but the way that Kevin Reddington got in that she's being sued civilly, because it was my
Right.
understanding they weren't allowed to bring it up. But what he did bring up was, did you work with prosecution before you testified? And she said no. And he said, oh, but you did work with another lawyer because you're in a big lawsuit.
He's so good, and everything he says is so, like, premeditated. I even felt like when he asked her husband, Clancy, whether he heard of Tim what was the guy's name? The person he had looked up. It was
The singer.
Tim yeah, he said the name wrong, and then he corrected him and said Tom, which was like a quick recall of something when he was acting like he couldn't really recall that time. It was such a smart strategy to say the name wrong. I really think Reddington is a powerhouse when it comes to questioning. I'm learning a lot while watching him.
Yes. And today, day 13, I want to say, really abruptly ended. And most of today was going back and analyzing the data on the computer and those searches and what was searched for and when. And I think the big thing today was when the suicide search occurred on the computer, Lindsay
Mm,
was not home.
mhm. It seemed like he was the husband was the one who searched that, and I guess he was trying to say that this artist had died of suicide. So it was like a natural hyperlink click that made him end up on that. But it's strange.
So
I
it's
tried to
just,
search how that guy killed himself, and then I got a thing saying, "I'm sorry, you're thinking about
I
suicide." It's
know.
like I'm having to a roadblock to even find
Yes. And I think what we're seeing is, the prosecution, well, I think we're seeing them lose, basically. Like, I just don't even know how anyone could say that she's criminally responsible at all. But I see them kind of dabbling in the data from the computer, the searches, the autopsy. It just keeps like being sprinkled in. And they really have, they're really trying to manipulate the jury. And they
they're trying
have,
to call them back to, "Let's focus on what was done to these children," which of course is horrible. Like no one disputes that. It's awful. But that's not the question really. The question is really where was her head and was she suffering at that time? And actually something that I think is interesting as to where her head was is that there's this discrepancy where emergency responders say she was nonverbal or maybe just moaning when they responded to her, but yet her husband said that she said that she had tried to kill herself and that the kids were in the basement. So I think the prosecution would use that to say that she was lucid. And she claims during her civil complaint that she was not lucid. She was in this other state and not in control of herself. So are there lucid moments during states like
Yeah.
that? Could it be she could have communicated and then, oh, the psychosis is still true? Or does it put a real hole into the state of psychosis argument?
Well, that's the difference between psychosis and postpartum psychosis. Postpartum psychosis is more of a medically charged psychosis, so it's more like a delirium.
Mm,
You're going to wax and wane, what in medicine we say wet, wobbly and weak. I think I can't remember, but you are going to come in and out of your very very severe symptoms. So you might not understand language and then you'll be able to talk. And then you hallucinate a voice and then you realize what reality is. And I do think that in that moment, so she tried to kill herself. She jumps out a window, and there was likely a moment of consciousness and awareness, and then she left again, and then her body temperature dropped so significantly. So you have this medical induced psychosis, I would say, this delirium, and then she shatters her back and her neck and how can we take anything that she says at that point, with any weight? Like we have to use such discernment because it's so complex, her physical and mental state at that time.
yeah. She also, when she was discharged from the hospital, McLean, she said in her own account that she was just in the best hospital in the country. So there's not much hope. And it seemed like she was just going to have to pretend that she was okay. Does that call into question accounts where people say she seemed okay? Like, could a person who is in this psychosis, which you're saying comes in and out, do some sort of fake it till you make it if they see there seems like there's no hope? Or is that too lucid?
I think definitely you can definitely fake it. And I think she did. I mean, they're trying to put up pictures of her out with the kids or at the pool party, and it doesn't mean anything. 8% of people walk around hearing auditory hallucinations every day all around us, and you don't know. Right? So interactions don't mean anything. And that's where I think the prosecution really lacks an understanding of mental health. And where it's going to kick them in their own asses is that everyone on that jury has had a moment where they've struggled with mental health or someone in their life has not, it doesn't have to be specific to maternal care, but they are mocking and minimizing the whole range of mental health that we experience. And I think it's disgusting.
It's true. I had a relative who was going through severe mental issues and he was violent and ragey at that time. But once he was properly treated, he was a different person. And you could tell if you were close to him that it was what was going on. And it wasn't I mean, it wasn't a intent to harm. It was really like he couldn't control his thoughts. So I think a lot of people, I mean, when even if you don't have someone in your life, you can definitely see when people are mentally ill, as much as they can be scary, you can tell that something is causing them to act that way versus someone who does something in a rage that kind of makes sense. I mean, Lindsay also acted like a good mom in many ways. And like when you look at the Facebook post she did, you can tell like she also wanted so badly to do the right thing. Or even when she told her husband, I'm scared, she's getting anxious about her daughter getting cold, and maybe there's something wrong with her liver. Like all these fears come from a place of love too. Such a tough
Exactly.
case.
I don't know how you can't really change that narrative. She looks like an extremely loving mother. But there's also one other thing like that we have to dispel is that I truly believe she was in a state of catatonia nearing the end of all of this. She was shut
Yes,
down.
can you explain that more? Because I saw your video about it and I thought that was fascinating.
Yeah, I think so. When we look at psychotic disorders, we look at positive symptoms and negative. So the positive are like hearing voices, delusions, the more active symptoms that people can see. And the negative symptoms are when people shut down and they start to live in the psychotic universe that's been overtaken their mind. So a lot of the time, I've had patients say, I sat on the couch for 3 minutes and I didn't move, and then the family will say she sat there for 3 days, and she had no awareness of that. So, I think saying that Lindsay was at a party and she looked like she wasn't communicating with people, seemed a
Mhm.
little anxious. We have these moments where she's moved into catatonia. She's no longer in the positive symptoms of psychosis, she's in the negative. And I think finding peace with now taking the direction of hallucinations that are telling her religiously, like because of her religion, that she should take the baby's lives. And she said, go with God when she did. And the only way that they could ever be together again was if she took their lives and took her own.
Ah. And her husband knew that she was suffering, maybe not to this extent. There's a lot of rhetoric about the husband, and
Yeah.
it's really hard to say. But are there training that goes into preparing the family when someone is experiencing or showing some symptoms like this? Like, are the
Yes.
professionals going to say, hey, look out for this, look out for that? If this happens, do this. And did that happen here?
It did not happen, and that shocks me as well. And for me, that goes both ways as well. Like, she told Patrick she had thoughts of harming the children, and he did not tell the psychiatrist. And so, there's liability on both ends when it comes to that. But the fact that we have all these medical professionals watching this woman completely deteriorate and knowing there are young babies in the home and knowing that it's because she's not sleeping and it's because of the baby, like they should have reached out to the family. One of the first things I always do is who's in the house? Are there weapons? Are you close to your neighbors? Do you have a routine? Does anyone else know your routine? Who do you call? Who do you text? Who do you check in with every day? Do you have a best friend? Right? Like, where was all of the curiosity about Lindsay's life other than just handing her over medications?
And no one got their hackles up when she mentioned fear of hurting her kids, which is so scary that that didn't raise alarms for anyone, including her husband and her family, her mother. Is that denial? Is this common to
Well,
be in denial?
I think it's very common to be in denial when I mean, they're a lovely family and educated, but this isn't their area of expertise, and it seems to me like they've just never seen anything like this or heard about it before, and it happened really, really fast. And so I don't think they knew what to look for and then what to do with what they saw. And that's the saddest part of all of this is that they could have had the education from the providers.
It really sounds like a failing on the provider's part. What else are we missing as the public from this child that stands out to you?
Well, that's a good question. I mean, I think we're missing discernment. The comments where people say, lock her up, she's a murderer. I mean, one, I think she's not guilty by reason of insanity or not criminally responsible. But two, if she is convicted as a murderer, she will go to prison and then she will just be sent back to the state hospital because the prison will not have the ability to care for somebody who is so acute.
Hmm.
So, what are we fighting for here? Where she lives now is where she will live forever. That's it. She will be in a state psychiatric facility, civilly committed with no end date.
Is there no way that she can recover mentally to the point where she could, if she gets the not guilty by reason of insanity, that she could actually come home? Because I looked into this and I think that it doesn't come with its own sentence, right? Like she doesn't have to be committed indefinitely. But in your
It
professional experience, you think she wouldn't come home?
She might, but it would probably be when she's very, very old. And if they determine that, it's you get yearly to 3-year assessments to see
Mm.
if you've been complying with treatment and the if you still meet that standard. But, she murdered 3 babies. And so you have to ask the clinical staff, are you sure that this woman should get out knowing that she so quickly went into psychosis and murdered 3 children? Like, your risk assessment is so important. How could you ever know for certain that you would recommend that she get out because you don't trust her brain now. And
That's a
so
good
you
point.
do these really like they're really hardcore assessments every year or so, and then you give it to you give it to the state board. There will be trials. If you think I think a good example is John Hinckley because his trials were all public, but you saw year after year after year they went to trial, they tried to get him out, they tried to give him day passes to go home, and then they kept doing it and doing it. And I don't know, is he like in his 70s now and he's out, but he's still being followed by the Secret Service. And he has a band. He plays guitar. I mean, he shot a president.
That's crazy. What about Andrea Yates? Is she currently still in a mental institution?
Yeah, she's still in a state
Yeah.
psychiatric institution.
Wow.
Yeah.
If you were advising the jury, obviously not on the verdict because we know your opinion there, but what should they actually pay attention to? What would you tell them to watch for if you were able to?
I think it's gonna be the battle of the experts. I think what they need to watch for is the nuanced way that the experts are interpreting objective data. Now, everyone is they're going to try and make everyone look like they're not credible, right? But if I give one test to Lindsay and another psychologist gives that same test, we are interpreting that test as well as the computer based on hundreds of thousands of normative samples. But we are still interpreting it ourselves. And I think the key here is to really listen to them and see, if you elevate on the scale on the MMPI, for example, like a personality assessment, you can elevate because you're feigning symptoms. You're not telling the truth. You're not telling the truth. Or you can elevate because it's a cry for help and you are so extremely ill that you're an outlier. You're outside of the normative samples. So a liar looks like they're outside of the samples. A really sick person does too. And so we need to watch with discernment how they chose the tests they did, how long they spent with her, what records they looked at, and really see how they came to their genuine conclusions about her mental state at the time of the crime.
That's an enormous charge on a jury. They're going to really have a tough time with this. I wouldn't want to be the one who has to decide this type of fate for someone. But just to end here, because I think it's important for anyone who's listening and is postpartum and is scared of their thoughts, what would you tell them?
First, talk to a psychiatrist. If you are taking medication, talk to your psychiatrist and genuinely ask them if they've had training in postnatal care. And then Dr. Fury, who she's on Instagram and she's on my page a lot, has an incredible course on how providers should train in postnatal care. And I've interviewed her before. She is a wealth of knowledge. So look towards the professionals who actually have done research and produced science based articles and information. As we learned with Tufts, she's never published. And that means she's never actively dug into this to understand it, to write about it, to have the board approve her article, and to publish it as findings. We have a lot of people who have done that, including me. So you can find a professional that fits what you need. But don't be scared. I mean, I think it's really we hype up medicine and psychiatry when it comes to pregnancy, and everyone's like, "Oh my god, get off your medication. Something bad's gonna happen to the baby." And that's where you really need to talk to a knowledgeable psychiatrist because there's a lot of misinformation going around. But I say,
Yes.
if you're pregnant or you're going to get pregnant, get your village set up. Get a psychologist, get a psychiatrist. Just have a village where you can call if anything goes awry. No big deal, just like you have your pediatrician.
Absolutely. And like you said, you should really research the person that you're going to see if you intend to seek any sort of, whether it's psychiatry or psychology, research their degree because there are different levels and like not to like crap on anybody's degree, but there's a difference between someone who got a 1 year certificate program and can do one-to-one counseling versus a 2 year versus a doctorate. and do with that what you will, what you financially can do with that or whether insurance covers it. But I would say make the best decision and then also see what their specialties are because everyone specializes in something else. It's important to have experienced professionals in anything, but especially in medical. And also, I just personally, I remember after my babies, my OBGYN did not talk to me at all about my mental health. She didn't even ask about it because she's there for the delivery. She's not there for your own postpartum health. But my kids' pediatricians always asked how I was doing and asked me questions. And I remember like, there were times where it made me feel so seen that he even just asked. So I think all doctors should be just checking in because there's so much power in a check-in, as we see, if people are just checking in. And people in your life, if you have a new mom in your life, it pays to check in. And as a new mom, it does pay to reach out and get those resources during pregnancy and afterward. And if you can pay for any help you can get, that helps tremendously. If you know of someone who is struggling postpartum or you are, the National Maternal Mental Health Hotline is free, confidential, available 24 hours a day, and you can call or text 1-833-TLC MAMA and AMA. And if you are having thoughts of suicide, call or text 988. You're not the first person to feel like this. And Dr. Leslie, you should follow her on socials if you want to learn more about this and follow all of the trials that people are afraid to talk about. She's a wealth of information. We'll drop her info in the show notes. Thank you so much.
Yes, thank you for talking with me. And again, like, no blame and no shame. When you need help, you go get it. Like, I think if anything good comes from this, it's that we've woken up this discussion in for women and awareness for
Yeah.
men of their wives.
It's about time that people started talking about women's mental health, what it's like to be postpartum, and also what we should expect for the partners in our lives because whether or not you want to be, you're involved with the woman's mental health postpartum if you have a baby with her. So it's time to step up. I'm glad we are in these conversations. It's an unfortunate way that we had to bring them to the forefront. Thank you.